Hi everyone, it's me again. So today we are going to talk about process mining, uh, but in a very specific domain, which is healthcare. Okay. So before I continue with the main topic for today, I would like to uh, give you a brief introduction of uh, our team and our collaborators, especially in this very particular field, which is process mining in healthcare. So, uh, until now, we have a very nice collaboration with lots of people around the world. Well, mostly, most of them are based in the UK. So, we just extend our collaborators, our team as well. Uh, I hope Miss Tisa will join us very soon and get your hand dirty with the process mining thing and all the data. So, just a brief introduction. uh, as you can see here, you will see uh, Mr. Owen or Professor Owen uh, on Monday next week. And then I work, me and Miss Ima are working very well with them. So in this particular domain, uh, there are people who already work in more specific area. So start from the left here, we have David. He works on frailty medication. So basically, he is a pharmacist and he has concern with the elder people. So frailty is about weakening condition for older people. And then we have Sam. She just got her PhD last month, I think. Yeah, MSK is musculoskeletal problem. So it's basically health condition that related with muscles and joints and etc. And this is Mr. Owen. His domain is healthcare and AI. And we have another Sam. She is also working in MSK. So two Sams doing MSK. And then Kiron, uh, he's working with the method. So he's really concerned with how we solve problems, basically using process mining approach. And then Chris, this is my close collaborator. He is a professor in cardiology, so heart problem, and I'm currently working with him, and also with another collaborator, which is Marlus. She's working with AMI. AMI is stands for acute myocardial infarction, or in English, in English we call it heart attack. So she is working with that. And the next one we have Richard. He's from Manchester and he's working with primary care. We will discuss this about we will discuss about primary care later on, and then what is primary care, and then I can show you. And then going to the right a bit, we have Nick. She's from Malaysia. She's also looking at frailty problem, but she's more concerned in the treatment, how we treat older people while they're in the hospital. And then going to the left, we have Miss Amira. She's from Saudi and she's working on diabetes patient. And then you go down to the right here. You already know who she is. So in process mining, her specialization is in cancer patients. And then going to the bottom, we will have Miss Tisa. She also will work in healthcare and AI together with Mr. Owen, I think. Yeah, hopefully. And then me, I'm working on a disease trajectory. I will explain it to you later on in the case studies, what we have done so far. And then going to the left, far left, we have a collaborator from Chile, and we are very lucky that we have him on board because process mining in healthcare was brought by Mr. Eric. So if you look for process mining in healthcare, you will see one paper named called Process Mining in Healthcare, a literature review. It was published in 2016, and he is the author. And yeah, he's kind of like the person who well, collect all process mining works uh, around the world, and then he also become the initiator of our community, and he's working in ER emergency room. I will show some of his work to you later on, and then we also have another clinician. He is Frank Fox. He is from Ireland, Northern Ireland, and he is a dentist. Even he is a dentist, has uh, he has interest in process mining. So yeah, now he is working with some health informatics group in Europe. So maybe sometimes we can invite him to give talk to us. Okay, yeah, that's just an introduction, sorry, to you. So if you uh, are going to join in this topic in the future for your final project, or just simply you have interest, you can come to me or to Miss Ima or Miss Tisa to have a discussion a little bit more about process mining. Okay, so for today, uh, I hope by the end of this class, you will be able to explain how process mining can help in analyzing and improving the healthcare processes, sorry. And then I also hope that you can identify opportunities, how process mining can help the organization, okay, in a broader way, yeah. And then the next one is I hope you will understand about the various level and classifications of uh, processes that happen in healthcare domain. And then I also hope that you are starting to get familiar with the type of research questions in this particular subject, process mining. Okay, so this is our subjects for today. I'm going to talk about what are the challenge in healthcare and how process mining uh, have been applied so far in healthcare processes. And then when we talk about healthcare processes, and we will look deeper what is or what are healthcare processes and how it's been structured in a way so we can understand what are the processes. And then for the last menu, I will show you, as I promised you, I will show you the case studies. This is the most cutting edge, not cutting edge, the most recent research in this domain. So maybe you can get inspired from here, and then you'll be able to find your own passion or interest. Okay, so right, and before I continue to the next slide, I would like to check everyone here. I'm going to make a separator on the chat box, and the next thing that I want you to put in the chat box is, since next week you will join Mr. Owen class from himself, or maybe on the Monday morning you will see him in the opening ceremony. I don't know if if you can see him or not. But I want to know what is your how do you feel about it? How do you feel about it? How do you feel when you will join Mr. Owen's class next week? Do you feel excited, or do you feel worried, or do you feel so-so, or yeah, or maybe you can tell me that you are scared, maybe, or you feel uncertain because well, maybe I need to because I have to join a class with foreigners, so I'm afraid or I got scared. Please share your feeling in the chat box. Uh, any kind of feeling you can. Well, there are range of feelings that you can choose. Don't make it hard. If you feel interest, you can type I feel interest, or I'm okay, or I'm happy, or you can say I feel challenged, sir. Okay, that's good. If you feel challenged, that it's good. Means that you will have this passion in this specific domain. Okay, so well, healthcare is still the um, concerning problem for Indonesia, especially when we are in this pandemic situation, right? So you can see our healthcare system is still well. There are still room for improvement, and I hope you can, all of you or anyone or any two from you can contribute in this area, especially for our country. So, okay, so I have some response here coming in. Hilal Ramdan, I'm feeling excited. Great, me too. I feel excited. Yeah. And then Budi, I have mixed feeling, mostly worry and interest. Okay, we can talk about later why you worried, what makes you worried, and but then the other side you have a positive thing. Yeah, it's you have interest. That's good. And then feeling curious. Muhammad Farhan. Yeah, feeling curious about the materials from Mr. Owens. Okay, me too. I have a great discussion last night with him when we have dinner, and I can't get many information from him regarding this glow event from starting from next week, and then well he just keeps saying that it's going to be very excited, and I hope uh, the students will like it. Okay, and then Naufal, I'm kind of nervous but also curious on how the class will be conducted. Yeah, well, in that point, me too. I feel nervous as well, and also curious about it. Yeah, just let's put a big hope on tomorrow's on next week's class. Yeah, so yeah, looking forward to it. Hasna, I'm interested, sir, because I want to learn about the skin cancer for my last project. Okay, that's interesting. You already have the topic. You already have the domain. It's very specific domain in cancer. That's great. Maybe you can explore more. Yeah, with the expert here, we are so grateful that we have someone who has background in cancer and she's on board as well with us. Okay, I think that's everything. Okay, I still have 5 seconds if you want to type something. Yeah. Okay, five, four, three, two, one, zero. Okay, right. I'm going to make a separator. I close this chat box for a while, for a moment. Sorry. Yeah. Right. So next thing that I'm going to show you is the challenges in healthcare. Yeah, our first topic here, first subject. So as you can see in this picture, this is the very old picture of how the patient being treated in the hospital during the World War II. I think so. A man laying down on the bed is a soldier. Yeah, he's a soldier, and then he's being treated with the nurse that time. Yeah, I just want to show you that in a long time ago, when we talk about medicine or medication or about healthcare, it's mostly or not mostly, it's usually we're talking about clinician. So medication depends on clinicians' experience on how good your clinicians are. But now in a modern day, this kind of paradigm or approach are shifted. Now they are looking at more data. They are concerned. They are looking at more uh, requirements or more aspects to help you fight your diseases or illness. Okay, and since then, uh, the healthcare costs are increasing. Why? Because of course the number of the population in the world are increasing. Yeah, despite at some countries there are aging countries, as you know, like Japan or some of the countries in the Europe. It's starting to have like upside down pyramid. So the number of newborns are less than the number of uh, those who are passed away or who died. So it's kind of like a worrying situation because of, in terms of a country, if you have like this upside down pyramid, it means that your future, the future of this country is at risk. So because who's going to continue to take care of the country if the number of newborns are very low. So it's concerning. And then since now we are using a modern technology, we are using computers. The computing powers are increasing. Now we have supercomputers. Most of the hospital in the world, well, not in the world, half of the world who already infected, in quotes, infected with technology. They use computers in hospitals, in healthcare organizations, so they can improve their service to their patients and improve the quality of the care process. And it follows with the next point where healthcare information system have hundreds of tables. So yeah, this is the effect of using computers, using technology. So we can get more data from the patients. Usually, uh, the clinician or the doctors just relies on our story. So we come to see the doctors and then we tell our condition, uh, what symptoms do you feel, and based on that, then the doctor will make a judgment on your health condition and then start thinking about the intervention. It could be medication or maybe like exercise or therapy, yeah, or maybe he just simply said you need to change your lifestyle, don't smoke, or get more exercise in the morning or in the evening. Well, it's just based on what you said. So since we have technology, the doctors can see our previous health conditions. So his decision will be, yeah, hopefully more precise. He will know, or the doctors will know, that maybe we have some type of allergies in the past that is still happening until now. So he can design what is the best intervention if you have allergies, or maybe you have like other conditions that is deteriorate 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 deteriorating your health condition. Sorry, I'm a bit jumbled. Yeah, makes your condition worse, like diabetes, or you have heart problems, or you have blood problems maybe. It also helps the clinician to design what is the best intervention for you. And then the last one is yeah, since we have the data, so we can use the data to improve care process while we reducing cost. So better care, better quality, better decisions, while we also, and at the same time we reduce the cost. So yeah, this is one of the main aim, a big aim for us in this healthcare. Okay, so yeah, I already talked about the human population is increasing. Okay, and then since we have better healthcare system, and this is happening in the UK, in England, most of in general. So since they have better healthcare systems, mean they can save more life. Uh, by saving more lives, mean we have more elderly now. So well, at some point, the chance of living are longer, and at some points it's also uh, the hospital or the government or the people here also uh, responsible to make them stay alive and stay healthy, and that's also a cost, also a burden to the healthcare organization here. But it's good. You can make people live as longer as they can, and that is really a good thing. And then another challenge is healthcare organization. It's a complex environment. What do we mean about complex? Well, uh, when they have to give service to you, uh, they're most of the time they're not going to work alone. They have to work with different kind of people, different expertise. There are some people who are expert in heart problem, cancer, or bones, and then medication, anesthetic, and the nurses as well. So they most of the time they will work together as a team, and then they will have these kind of discussions uh, to save the patients. So sometimes I'm jumping to the last point here, the hospital political battle. Sometimes in the hospital there are things that hold the operational, how the hospital works, because something like political things, yeah, it happens in well, in most of the organization there'll be some politics involved. Maybe it's not the politic in a big settings, just maybe a local politics, like and dislike based on the leaders of the hospital and some sub organization or some uh, part of the hospital. Yeah, it happens, and sometimes it can bring a good thing, sometimes give you bad things as well. And then the next one, there is a subjective view on how a process is executed. Yeah, back to the experience of the clinicians or the people who works in the hospital. They have their experience, they have their knowledge, and sometimes uh, it makes them what like trying to push the way he or she treat patients. So there's some subjective, like based on my experience, and and they don't want to see, or they don't want to include some other experience or some others ideas in how to treat the patient. So sometimes it brings problem. Okay, so uh, on the diagram on the right side is just show you the trends on how uh, a country or a nation have to spend their money to treat elder peoples, yeah, uh, age 18 years old or over. So because since they are frail, yeah, frailty, since they are frail, so most of the time the cases that happens in the hospital are usually you will see more elderlies in the hospital for treatment. So the objective suggestion to improve and to redesign these processes is one of them is by exploiting the event data that is already there. Hospitals, healthcare organization are collecting data, so we can use that to improve the quality of care, and that is why we learn this topic. Okay. Next, the application of process mining in healthcare. How process mining in healthcare being implemented? So it's still using the the types of process mining activities, which are process discovery, conformance checking, enhancement, and I believe you already heard about this. So in process discovery, we're trying to look what is really happening, what what are things that the data tells us. So that's our job, to explore the data and see what is actually happening, because the activities or the information, the data that is actually happens in the real world are also available in the electronic health records. So it happens in the data. Okay, so we're not yeah regarding the how good the data is being recorded is another problem, but at least uh, we know that the data is there and it's ready to be explored, exploited, and I hope we can learn something from there. And then for conformance checking, we can check the deviations. So uh, is the processes follows a certain guidelines or not? So if you are conducting uh, heart surgery, maybe there is a standard operation procedure that every doctors, every nurses, or anesthetics that have to follow. Did they follow the guidelines properly or not? So we can check that using process mining, and then also we can do some enhancement. We can repair the process or we can extend the process uh, using process mining. So this is just one example of how we applied process mining. So pretend that there is a patient named Bob, and then as you can see, this is the process model. Uh, how Bob uh, had been treated in this very hospital. So first time he came to the hospital and then met Dr. Anna, Dr. Anna here. Uh, this is his first consultation, and then Dr. Anna suggests him to get blood tests, a physical test, and also X-ray scan. So three activities has been suggested by Dr. Anna to Bob. So the system also record this kind of activities. We can see the dates, and depends on the granularity of the data, how details the data has been recorded. In here we can see years, month, date, and hours and minutes, but not seconds. But yeah, uh, many hospital have their own policy on how detailed you will record the data. Okay, and then you can see here there is another column called notes. So we can see what happened in that very activities, like, okay, so we know that Bob has been taken 2 tubes of blood sample, and then from the physical test the result is Bob is fit. Okay, and from the X-ray scan uh, we have 4 images of his from this scan. And then we also know who performed the activities. Okay, blood test, we know that it's being performed by the lab. And as for physical tests, Bob met Dr. Ben, and X-ray conducted by Team One, and etc. And then Bob returned to Dr. Anna for second consultation, and then it's been decided that Bob is ready for surgery, and then Dr. Anna referred Bob to Dr. Charlie for a surgery, uh, and then after uh, the surgery was done, and then he come back to Dr. Anna for final consultation. So this kind of things that is being discussed or being analyzed in process mining, and then I can show you some more in the later section of this class. Okay, right. So the next topic is healthcare processes. So I kept telling you about healthcare processes. Okay, so what is healthcare processes? So in this topic, we are focusing on evidence-based medicine. Okay, so traditionally, medicine was based only the experience of medical doctors, like I said before. In the near 90s, yeah, 90s, a new approach called evidence-based medicine was initiated by some doctors in the Europe. And this approach is proposing a new way to, well, they call it normalize the care of patients. Uh, why? Because before that, they thought they considered that the previous processes is not normal because it is only based on the clinician's judgment, not based on the patient's the actual condition that patients uh, feels. So there's a person named Sackett. He defined evidence-based medicine as the conscientious, explicit, and judicious use of the current best evidence in making decisions about the care of individual patients. So evidence-based medicine, uh, it doesn't only take into account the physical aspects as usual, not just the physical aspect, but it also includes the latest discovery of medical evidence, okay, which is now is getting better and better because of the development of science, technology, and also this kind of approach is patient-centered. Okay, what do you mean? What do we mean by patient-centered? So the patient is the main source of information, the main source of data, and we consider we see the patients as the main subject here. So it's not based it's not or it's no longer based on the clinician's judgment, but the clinician helps the patient to understand more about the patient's conditions. So based on this definition, we know that the healthcare processes can be seen from just one point of view, but also in the patient point of view as being put as the center of everything and every decisions to help the patients to uh, combat their disease. Okay, so healthcare processes have many different levels of care. As you can see on the top part, uh, there are primary care, secondary care, tertiary care, and emergency care. And the bottom part is diagnosis, living with conditions, escalation, crisis, end of life. Just by looking at these levels of care, and we already discussed about the different type of point of view. We cannot see medicine just from one point of view. So I want you to think which point of view is the top part and which point of view is the bottom part. So the options are the hospital system, and the second option is the patient. So please type in the chat box which one is which. Does the bottom one is the patient's point of view, or the top one is the patient point of view, or vice versa? So the option is, so your answer will be top hospital system, bottom patient, or top patient, bottom hospital system. So please, you can guess from now. Have to think about it for a moment, and then you can start typing your answer. Okay, while I need to fix my throat a bit. Okay, bottom patient, top hospital, Muhammad Farhan. Okay, Aulia, top hospital, bottom Patient perspective, yeah, similar to Muhammad. Rishad, top hospital bottom patient. Hilal, top hospital bottom patient. Okay, I think just from four answers, they have the same thought. Anyone still want to give their opinion? Okay, give you 5 seconds. Five, four, three, two, one. Okay, thank you. Yeah, last one is Budi. Top medical procedures, bottom patient. Yeah, I think everyone uh, had agreed that the top one is from the hospital point of view, and the bottom one is the patient point of view. So, primary care. What is primary care? Primary care is the first point uh, where the healthcare service is being given, and also the first point of patient to get help. So, well, usually primary care is like in Indonesia is kind of like what uh, puskesmas, I think, puskesmas, or on when you just simply visit any clinic like Kimia Pharma or something. That's the primary care. You see the doctor, and the doctor will uh, check your condition, make the diagnosis, and then give you some medication, and then you'll be sent home. That's primary care. Yeah, and in the UK, this primary care is they have like a facility called GP or general practitioners. So the first person that you ask for help is general practitioner, or in Indonesia we call it dokter umum. Okay, so you will be checked or diagnosed with them. And then secondary care is an escalation from the primary care. Secondary care is hospital. So when you being admitted to the hospital, it means you are in the secondary care. Okay, and then the next one is the tertiary care. Tertiary care is for more specific condition. Usually in tertiary care there are specialists like uh, cancer specialists or heart specialists, or maybe rare diseases. Yeah. So yeah, it uh, that is part of the tertiary care. So for very specific conditions or problem. Okay, and then the next one is the emergency care. Is yeah, as you know, when you got acute condition like heart attack or stroke, or maybe from accidents. So you will get in this emergency care, the service will be given right away based on the patient's condition, based on the triage, they say, based on the triage, and then you will get help immediately. So compared to primary care, usually you have to make appointment first, and you need to wait for a moment before you see the doctors. Okay, so that's the level of care in the perspective of hospital system, and in the perspective of the patients. Well, when the patient feel something wrong with their body, uh, the first thing that they think is, I need to see the doctor. Okay, when the patient see the doctors, he got diagnosed with the clinician, and then the patient have to accept that, okay, I need to carry on this burden, this illness or this disease. So they have to live with these conditions. You have to live with your allergic conditions, or maybe with many limitations. Maybe if you have that one, like I have uh, non-regular rhythm of heartbeats, maybe, or you have blood cancer or something. yeah, you have to cope with that, and you have to live with that condition. And then when the doctor said, okay, you need more treatment rather than from this rather than from my treatment, and then the patient will feel, okay, this is an escalation. I mean, I know that I'm being sent to a uh, better treatment, better facilities maybe, or better person in terms of experts. Okay. And then at some point, when the doctor said that, okay, sir or ma'am, your condition is getting worse, and the patient will feel, okay, now I'm in a crisis, or maybe I need to get more intensive treatment, or maybe the family will feel that, okay, we are in crisis because my family are being sent to the ICU maybe. Okay. And then also at the end of the journey, at some points, the patient will not be able to survive, and uh, their life will be ended. So yeah, this is the healthcare processes from two perspectives. The next one is how we classify healthcare processes. So this is the classification that happens in most of the healthcare organizations. So basically, they are classified into two big groups. First one is non-elective care, and the other one is elective care. So uh, start with the elective. Elective is care that care for non-urgent situation, non-acute situation. So it's being divided again into standard, routine, or non-routine. So standard one is the regular things that we usually do. So I got ill, I feel something, I see the doctors, and then done. And then the second one is the routine. So if you have like a condition in like uh, diabetes or something, that you need to get a regular treatment like hemodialysis. So you have to go to the clinic to wash your blood, unquote, or you have to routinely receive treatment for cancer, maybe. Yeah. And there is also another non-routine activities. Okay. And as for the non-elective care, this is the urgent condition. So there are two things: emergency and urgent. Emergency is for the acute condition, heart attack, stroke, something like that, or when you involve in an accident, that's emergency. And the second one is urgent. Urgent is usually started from the primary care. You've been seen by the doctors, and then the doctors realize that your condition is worsening, or not in a not in a good way. So he will refer you and put label as urgent, means you really need an immediate treatment. So that's the difference between urgent and emergency. Okay, well, uh, yeah. So the next one is, in healthcare processes we have levels, we have classification, and then this is the type of questions uh, that becomes our interest. Okay, because, well, in our domain, we can also use this as a research questions. So there are four types of questions. The first one is what happened, and then the second one is why did it happen, because we want to know the reason why this is happening. Okay, and then once we know the reasons, and then using the process mining approach, maybe we can see what will happen. So what will happen next? It's kind of like predictions. Okay, and then from there we can select what is the best can happen. So the different from the previous one, what will happen? It could be positive or negative, or positive like okay, you will be go back to your prime conditions, or the negative is maybe you will need to be treated more, or you will receive more treatments or more surgeries maybe. Okay, and then the last one is what is the best that can happen. So the best that can happen is more specific things that are really really expected. So yeah, there's like different value from the previous one. Okay, so that is the levels, the classification and questions of healthcare processes. Okay, before I move to the next topic, which is I'm going to show you some case studies. Uh, Maybe you have questions. If you have questions, you can uh, type your questions in the chat box. Okay, I forgot to put the sorry, to put the separator here. Give me a moment. Right. So if anyone have questions, please you can start typing your questions. Mhm. Nope. Okay, I'll take that as a no question. What? I will carry on to the next slide. So next one is I'm going to show you the case studies that has been done by one of our team members and our collaborators. Okay. Uh, yeah, I hope you can get inspired from these case studies. So first one, I'm going to show you the process mining in emergency room. The main researcher is Mr. Eric Rojas, the one from Chile. Okay, so this is what he did for his PhD. So he's he did the investigation in emergency room in Chile. This is the hospital's name, Red de Salud Christus. It's in Santiago, Chile. It has 11 medical centers, 1,000 doctors, and 4,000 professionals. And his data uh, called His Alert ADW Phase 1. So it's quite recent data because it has data in 2014, in July 2014. He analyzed 39,000 episodes with 1.7 million events. It's a big data. So from there, he did some process discovery, and then he he found this process model. So the question is, what activities are carried out and what process is followed in providing attention to emergency room patients diagnosed with appendicitis. So he make a narrower case studies. So he's looking at patients that diagnosed with appendicitis. Appendicitis is usus buntu in Indonesia. So you can see on the left, this process model is started with chief complaint. Chief complaint is not a complaint, something like complaining. You don't like something, then I make a complaint. No, it's not like that. So chief complaint is a common term in emergency room to tell you what is your main condition. Yeah, or in hospital we call it primary diagnosis. Okay, but in here we call it they call it chief complaint. So what happens to the patient, what makes him or her uh, being admitted to the emergency room. So uh, from the 31 patients here, so it started with the chief complaints, and then uh, go to the triage, and then the triage they have differential diagnosis, and then some of them are re-diagnosed, and then most of them are discharged diagnosed, mean the treatment is done. And then we can also see that after being discharged, somehow 12 patients uh, being re-diagnosed. Maybe uh, they still found something wrong, or they didn't feel that they got proper service or something. Yeah, we don't know. That's the thing that we need to explore more. Why did happen? Why it happened? Okay. So and then he expand his analysis to see how the people in the emergency room is working. So, well, of course, in this from this process model, we know that when the patient came in, uh, they will be welcomed by the nurse, and then there are more people or more roles are joining in to give the treatment. We see there are technicians, there are physical exams, and then people in biometry, and then surgery sometimes, yeah, for some patients. So this is what he did. Just a brief introduction of what he's done using this data. And there are some more interesting results, but I didn't put it here. So when he checked for different type of patients, uh, the process models are similar. So we can see that if you being admitted to emergency room, they already have a very good standard of how to treat the patient, because the process model is similar for any kind of diseases, for any type of patients, like whether you are old, you are young, male or female, uh, you'll be treated in a very standard way. Okay, that is one of his findings. And then the next one is process mining in oncology. The main researcher is Angelina Corniati. I know, I think, yeah, I believe you know who she is. So oncology is other name for cancer. So cardiology is for heart problem, oncology is for cancer. And then she analyzed process mining of chemotherapy in Leeds Hospital. So uh, Leeds is the one of the center of cancer treatment in the UK. So, and she's looking at the chemotherapy pathway analysis. So there are cancer patients being treated with chemotherapy, and then she used process mining to see the patterns. Okay, and in here, this is the process model that she extracted from the data. So there are patients start with the chemotherapy, and then being discharged home, and then the patient will go back to another chemotherapy sessions, and it happens for several times. And some of them, after they receive chemotherapy, they have to go to these events called neutropenia. And then when you got discharged, some of the patients will go to the emergency service. Maybe their condition is worse or something due to the chemotherapy sessions. Yeah, and then this is what actually happened in the hospital, because she used the electronic health records that are already available in the hospital, and from there we can also see how many patients uh, uh, went to this type of sequence of events. We can see the percentage as well. And then in process mining also we can see uh, more details. So chemotherapy is composed in 6 cycles. So the patients will have 6 cycles of chemotherapy. Some of them don't have to go uh, all the way until 6. Maybe they depends on the clinician's decision whether it can be stopped at cycle 3 or should be uh, followed through until cycle 6. And then the image on the left is like a rainbow with a rainbow color here. This is it called dotted chart showing the patient pathways over their duration of treatment. So you can see that the cycles has been conducted very nicely. Start with cycle 1, the purple one, and then followed with the orange one here, which is the cycle 2 is happening, and then the cycle 3, and etc. Okay, and on the right side, this is the process model when the patient begins with the cycle 1 and then uh, followed with cycle 2 and then cycle 3, and some of the patient from cycle 1 have to go to the new sorry neutropenic and etc. Yeah, and so on. So yeah, also again this is being modeled using the already available data. And then the next one we have Frank Fox. They use process mining in dentistry. So because yeah, well, of course he is a dentist. And then the data that he used is called Bridges. Is a dental electronic health record from the Irish Public Health Service. It's also quite recent, from 2000 until 2014. So the data has 15 years of time spent. It contains clinical, administrative, or oral health data. The number of patients is 200,000 ish, with 3.1 million events. Okay, and what he's looking is he looks for the he compared the actual processes with the guidelines. So uh, are the processes that has been done or that has been conducted actually follow the guidelines that has been pre-designed as a standard. So when he look at the data, we can he can see so from the guideline here, you can see that on the right side with the pink line, uh, this is when the patient receiving an urgent care. So for the urgent care, when you suddenly got a toothache, you will see the dentist, and then you got a pain relief, and then you will recommend it for more assessment. Okay, and at this cycle here, and then on the left one is the routine care when, well, there is no acute condition. Your teeth are fine. You just need to check their conditions, and then when he start compare it to the actual data, and then just by uh, looking at this process model, he can create this line that okay, on the right side is the urgent activities or urgent events, and on the left side is the routine events. And then you can also see that the length of the sequence of events are shorter than the routine one, which is expected. So from here, he can say that okay, so processes that happen so far is well comply with the guidelines. And then the next one is process mining of disease trajectory. This is a quite different approach of using process mining, and the main researcher is someone that maybe you don't know, or maybe you already know. Okay, so what happened with disease trajectory? So in here, well, during our life, okay, say patient A until he died. Maybe he suffered with so many type of diseases, like disease 1 at T1, disease 2 at T2, and etc. until he died. And then there is also patient B. He also suffered with disease 1 at T1, disease 2 at T2, and somehow she still survived. And this type of footprints, if you can say, uh, they probably totally different from one another. So maybe my journey, my CV or my curriculum vitae of diseases are like this, and this, and maybe you probably have the same uh, story with me, or maybe you have a very totally different story with me. And then using process mining, I look at these patterns for all the patients, whether they somehow at some point or at some sequences they share the same story. Maybe out there you have twins in terms of your story of diseases, maybe. So using this process mining method, I saw that there is an opportunity that I can use process mining methods to reveal this kind of story, or we call it disease trajectories. So, or when we're talking about activities in the event log, I don't use activity, the actual activity, actual process, but I'm taking the diagnostic codes as the activity. So it's a well, a bit different approaches, but the idea is still the same. I want to see the sequence of diseases with help of process mining, because process mining is good at recognizing the patterns, and that's why I use that approach. And what data that I'm using? So my data is from the England's hospital. Uh, I'm working on 34 million patients, and the total number of episodes is 145 millions. And if I don't use process, if I so this is the type of process model. If I just deliberately use process mining to capture what happens in the data. So in here you can still see uh, uh, what do you call uh, different stories of patients. Whether one patient goes to, so it's too small for me. Sorry. So this I63 here is stroke. Yeah, and then, oh sorry, this I63 is stroke, and then some of the patient will go to the I21 is heart attack. So there are patients that suffered with stroke first and then heart attack, and there are some patients that suffer from heart attack first and then stroke. So in disease trajectory, I'm looking at which one is uh, occur more dominant uh, based on time. So which one comes first in here, and then does I want to see which one comes through, is stroke first or heart attack first. So and then I develop a method to look to identify the trajectory. So because trajectories is can only goes one way, you can't go either way. So you can go one way, or you can't have a repeated conditions, like once you have a heart attack, most likely you will have the second heart attack, the third heart attack. So I'm not looking at the repeated events as well. So I just only looking at the first ever occurrence of diseases during someone's lifetime. So Usually you can tell your story, okay, I've been diagnosed with this, and then I've been diagnosed with that, I've been diagnosed with COVID, and then I've been diagnosed with something else. So that the main stories of diseases that I'm really interested in. And then after I developed the method, I reapply the method on the data, and then we have this type of process model. There is no more loops, there is no more bidirectional uh, sequence. Now we can see here that after heart attack, we will suffer. Well, most of the patient will have ischemic heart disease, and then where's stroke? So yeah, the stroke is over there down on the bottom. So uh, more uh, the most dominant case is heart attack first, and then you have stroke here. So I'm using Disco to analyze this, and then you can see what happens after you have heart attack. You have ischemic heart disease, and you have angina here, and then you have some other ischemic heart disease, and you have AF. AF is also a heart problem. Yeah, and then using process mining, I can identify what are the common traces using the data. So we have COPD is well, COPD is the medical name for the COVID-19, the pneumonia. This is the one that makes people hard to breathe because their lung is now full of liquid, so it makes them hard to breathe. And then the second common trajectories are disorder of urinary systems, and then followed by pneumonia, and then the third common is heart attack, and then followed by ischemic heart disease, and etc. And then this is the shortest duration. So uh, using process mining, I can identify, okay, uh, from heart attack to the second uh, diseases, it happens in zero. Well, this is in month. The duration is in month. So you will, after you have AMI, you will have ischemic heart disease within a month. Well, this is most likely. This is the shortest duration. Or the second shortest duration is once you have heart attack, you will have other type of ischemic heart disease, or you can have uh, both I-25 and then followed by I-24. And then the fourth one is regarding the digestive system. So this is the result that I've got from the data. And yeah, I have a different approaches of using process mining into this particular problem. So uh, why I do this? Because I want to see what is the actual burden of people, of hospitals in England uh, regarding their patients' condition. So in here, maybe if you can map these common diseases by looking at these disease trajectories, maybe the hospitals or the authorities can make a better planning, better intervention for the patients, so they can increase the quality of the care. Okay, so I'm afraid this is the end of my presentation. I think we still have times for discussions. If you have questions, if you are curious about some particular topics, you can use your microphone if you want. So you can ask me questions, or you can ask. We still have Miss Angelina here, Miss Ima here. So I also present one of her research. Okay, please, anyone, if you want to ask questions, or you can type your questions on chat box, or you can use microphone, or You can raise your hand and then turn on your microphone and start uh, telling your questions. Anyone? Or we can, yeah,
Hello.
yeah. Okay, Budi, I hear
I would
you.
like I would like to ask,
Yeah.
um, is there a point where a, where a certain disease evolves so rapidly that data mining data mining alone is not enough to catch on and analyze about like a disease, like let's say COVID,
Mm-hmm.
since there's like new forms of COVID coming out.
Mm-hmm.
Is there a
Okay.
point where the disease is like it evolves way too fast for us to catch up with it with data mining and analysis?
Yeah. Yeah. Well, okay. Are you finished with your questions, or you have something more
No, no,
to?
no. That's all my question.
Okay. Right. So, is there any ways that data mining can or cannot capture those? Well, I use the term phenomena of evolving diseases like COVID. Yeah, we have first we have the alpha version and then the beta, and then we have delta right now, and then we just heard in the news that there are lambda version of COVID-19. Yes, well, the technology or the data mining method is really good, really good. But sometimes we are dealing with other things that outside the data mining, like how fast the people or the clinician respond to the reports. As you can maybe remember, uh, the first doctor who died in Wuhan, he already blow up this kind of virus in late December 2019, and then uh, the authorities in the country were late to respond to this type of virus, and then that's why it becomes a pandemic until now. So there are other things that data mining can't uh, handle that situation. But since now people are getting aware of this kind of virus, I think now people will starting to concern if anything related with COVID condition, they will try, they will do their best to capture uh, what is this new virus, and then they start to record that into the data. So once this type of condition, this evolve, this type of disease, or the yeah the evolution of well, say the evolution of this virus being recorded, then the data mining uh, can come into play to analyze this. And also data mining also related on how much data do you have, if this data enough to be analyzed, is the data representative enough uh, to to be used as a base to decide, okay, this is a new type and we should be aware of it. Yeah, so there are things that outside the data mining area that we can't control, but once it's already there, once we have the data, then we can do something. Yeah, I hope that answers your questions, Budi. It's very good questions. Thank you very much.
Mhm. So basically, like external features are like noise in the data mining
Yeah,
in the
probably.
data set, like
Mhm.
noise.
Yeah, yeah. Well, noise is a common thing in data science, and yeah, it's a common thing, and you have to really careful about it. First, you need to know, is it noise, or if the noise are too common, then we can't say it's noise. So you have to really you have to identify it really carefully before you decide, okay, this is noise. So when it is noise, you recognize and you have a very firm base that this is noise, then you can do something from there. Are you going to remove it, or are you going to keep it, or are you going to change the data? Many approaches you can use in that data. Okay, yeah, I hope that answers your questions. Okay, anyone? If you still have burning questions and maybe you are too shy to ask the question, that's fine. I can totally understand. Uh, you can you can send your question in WhatsApp group, or you can send me in an email or something. Yeah. Uh, Me and Miss Ima and Miss Tisa will do our best to answer that questions. Okay, well, I think we can call it as an end into this for this class. Thank you very much for your attention and the questions and the interactions that you have been given to this class. Really appreciate that. So let's give a reaction. I want you to give reaction. Just give a thumbs up to everyone, or uh, big applause to everyone.